Good afternoon, everybody. It's Tuesday, the 9th of March, 2021. My name is Margaret Jennings. I'm a microbiologist and infection prevention control educator, and I'm thinking about everybody launching into running their vaccine arm of their clinic. Now, for general practice, it's prided itself on that individual approach, caring for the patient. I'm here to tell you that we're talking about mass immunisation here, mass vaccination, which none of us have ever really been involved in, really. And this is a sausage machine. But we need to make sure you've got the safest and best sausage machine that's going around. So not forgetting, we are in the middle of a global pandemic. There's nothing telling me that there are no cases around the world, and we're certainly getting between 10 and 15 new cases into Australia every day through overseas flights. And, with quarantine, we have had outbreaks, quarantine into the community in every mainland state in the last 6 months. So this becomes our risk, of course. And whilst we have begun to immunise the quarantine workers and aged care, etc., now following, what I can tell you is that people drop their guard. People drop their guard, and before you know it, you've got somebody turning up at your clinic, not your vaccine clinic, but your clinic, and who's a quarantine worker and not feeling good, but kind of thinks that because immunisation is happening, it's not COVID that they've got. So this is a real plea that we understand where we are in the middle of our pandemic, and we don't do anything risky. So what are the things I would be expecting? Well, you're running your clinic as COVID normal as you can. So we're just not using our waiting rooms as much as we ever did. We know that what transmits this is time and distance. It's longer time, closer distance. And so, yes, we're treating every patient who comes in the door as a potential COVID-19 patient. We know nothing about them. But what you would ask definitely before people come, when they book, etc., is symptoms. So don't let yourselves down there and just think that a temperature check is it in a bit, because less than half people will have a temperature. And don't forget, a half of people who will attend with COVID will be in fact asymptomatic. Some will, about half of those will go on to have symptoms, but a half, maybe 20-odd%, may never exhibit any symptoms. In fact, they might come to you in their infectious period for something else. So don't let your guard down. This is how we're running our clinic COVID normal. We pay great attention to being able to do as much telehealth, and if I can't do complete telehealth on one person and they need to come in, then maybe I can see them in the car. Maybe I can see them under my marquee outside. Maybe I can see them just inside the treatment room with an open door. We've both got masks on. Windows to open windows, open doors, etc., etc. This is where we are in March, and we've probably got our most dangerous period coming up, actually. And it's been shown in other countries around the world that when the vaccine is introduced, the cases go up because people drop their guard. And that will most likely happen to us. But remember where the source of our cases are. It's essentially from quarantine. At this point, we don't have any community transmission as of today. People may rely on contact tracing. Well, I'm here to tell you that by the time you get a tap on the shoulder to say you're a close contact, the cat's out of the bag there, and that's telling you that you are a close contact. I think we need to be putting ourselves in our position in our practices of that tap on the shoulder, and then, yes, we had our masks on. Yes, we use our sneeze shields. No, we don't see patients in the consulting room unless we have to, and it's for a short time. And we stand back and we both have masks on and the windows open. All those risk drivers up and down, you can use very confidently. So no, patients are coming into my clinic without a mask on. Thank you very much. For an immunisation. I'm thinking of my particular clinic that I go to. They've got a door to outside from the treatment room, and I'm pretty sure we'll all be lined up COVID safe out the back there and called in to have our shot, maybe near the door, so that we've got unlimited exchange of air. That's important. I'll have my mask on, and I know that the nurse immuniser will have her mask on too. I know that I've got to wait for 15 minutes looking at the cases of anaphylaxis so far. All, I think, except one have occurred within 11 minutes, and hence the need for the 15 minutes. So make sure the patients aren't out of your view, which can make organising really tricky. But remember, we've never done this before. Normally 5 million immunisations are given per year in Australia, and we're looking at 25 million plus. It is huge. So don't be sort of too snappy with the authorities, even though we all wanted it yesterday. I think for a lot of us as a scientist, you are enabling the work that scientists have been doing. And for a lot of scientists, I can tell you they're pretty upset at people who are saying, oh, I don't think I'll have it this year, or I think I'll wait. All that work that's gone in, all that heartache, and the people who've died. That what drives you should be, I need to protect as many people as possible. But we don't want our vaccine clinic to be an occasion for a super spreading event. So just as we're getting to that, I guess, that hurdle, people dropping their guard. You'll want to know if people have any symptoms. That needs to be checked before they even sit down to you. One little tip I can give you that one clinic, number of clinics are doing is you both do your hands, you pass the patient their cotton ball, and when you've done them, they do that and they can get up and go. So there are some really good tips around there, but you both do hand hygiene, both got your masks on, and it is not a consultation. It is an immunisation, and it's mass immunisation. So get your minds around, it's not that personal thing that you're used to doing, patient to staff ratio 1-to-1. This is very different. And best of luck. And thank you.